I'm really equally delighted to be here for our third installment of our customer talks, which we are presenting alongside our partner UNICEF. These customer talks are a great way for us to step back from the day-to-day work that we have and to look at some of the challenges that we're facing and how we can look at some of the solutions and work together to solve them. For those who don't know us, SATO is a brand of Lixil, which makes pioneer water and housing solutions globally. And SATO as a brand has the purpose to empower everyone everywhere to live a better life every day. And we do this by designing affordable and innovative and relatively simple sanitation and hygiene solutions that can help to increase access through marketplaces in emerging economies and areas that typically have been underserved for sanitation and hygiene. We're proud that to date, we have impacted over 35 million people across 44 countries, with our ambitious goal with Lixil of reaching 100 million people by 2025. Sustainable school sanitation is a part of our SATO strategy to increase the global access to improve sanitation and hygiene. We see schools as an essential component of that strategy, and it led to the birth of what we call our School Toilet Enhancement Program, or STEP program. Since 2020, we have upgraded 36 schools and impacted 45,000 children through this program. We believe that we can work with schools to support them to upgrade their facilities, and these initial schools that we've done have already catalyzed many more requests from schools to partner with them. But why school sanitation? We often talk through our goals about household level sanitation, but sustainable school sanitation is especially important to us and to us as a sector because we understand two main things. One is that clean and safe sanitation and hygiene facilities keep children in school. And we know that they particularly help keep girls who have reached puberty to stay into their studies and to be able to continue their days of learning. The second main point is that schools serve as a hub for the broader community. And so we can use the schools as a focal point for educating about sanitation and hygiene best practices, demonstrating solutions, and also reaching a broader community beyond school children through events or other activities that may be hosted by the school. These make schools a very impactful touch point in communities and a strong foundation for us to establish markets in the communities where we aim to work. The features and affordability of our SATO products, we believe, can make them an important tool for partner organizations and communities looking to upgrade their school facilities. And we're really proud to serve as a leading technology provider to these schools and to other institutions. We are now looking to expand our STEP program, investing not just more in Africa where we've started, but looking to our markets in India and to our partners in Southeast Asia as well. Importantly, we do know that it's not just about the initial investment. We can't just build or upgrade school toilets. We have to partner with schools who remain challenged by an ongoing lack of resources, whether it's human or financial, to clean and maintain these facilities once built, and to also continue to educate about the behavior change and the use of these facilities over time. We as a sector can now come together to ensure that school sanitation is a priority. And I am really excited about the caliber of experts and voices that we're going to hear from today to share their experience on the subject, share solutions that have worked from them and perspectives on the day-to-day and ongoing aspects of school sanitation. So I don't want to hold this up any further. Let's get started. Fred, if you're able to rejoin us, I'd love to turn it back over to you.
Thank you so much, Erin. Let me know if the sound is better now.
Sounds much better, Fred.
Thank you so much for that insightful opening remarks, Erin. We thank you so much for guiding us at the whole of SATO. And without much further ado, I think for us, the importance of achieving the SDG targets and reaching those 100 million people by 2025 outweighs the kind of challenges we are discussing now. So let me just go next to Anne as I sort out my audio issues. Anne, over to you. Anne is our key partner as well for improving schools and sanitation here. So over to you.
Great, thanks so much, Fred, and good morning to everyone from UNICEF headquarters in New York. It's a pleasure to join our colleagues at SATO today and all of you for this SATO UNICEF customer talk. Last Saturday, on November 19th, I think many of you might have known that it was World Toilet Day, and we had people all around the world coming together to celebrate and an opportunity to raise the profile of the global sanitation crisis affecting 3.6 billion people around the world. While progress is being made, especially on ending open defecation amongst the most vulnerable, we're still very far off in our target to reach universal access to safely managed sanitation and hygiene by 2030. And to actually reach the target, the SDG 6.2 target, we will have to quadruple our efforts. And that's why we're here today to talk about the role and the unique opportunity that we have with the private sector to accelerate. We are proud in this theme to be collaborating with SATO on the Make a Splash partnership. It's a shared value partnership that brings together two very different organizations with very different expertise, working together to support vulnerable populations around the world to access safe sanitation and hygiene services. The Make a Splash partnership links SATO's sanitation market expertise with UNICEF's global engagement with governments to support systems to enable and create demand for safe sanitation and hygiene. Today, the Make a Splash partnership is working to strengthen sanitation markets in 6 countries: Indonesia, Nigeria, Tanzania, Ethiopia, and Kenya, with an aim to support 5.8 million people in accessing safely managed sanitation by the end of 2023. And this is contributing to the 1 billion people that UNICEF is committed to support to reach safely managed sanitation by 2030 by our own global game plan to reach safely managed sanitation. But today we're highlighting the importance of sanitation in schools and what the Make a Splash partnership is doing to ensure that our children are not denied education because of poor sanitation. Globally, over 500 million children do not have access to basic sanitation services in school, with only 49% of schools in the least developed countries having access to basic sanitation. This is only 1% higher than where we were in 2015. At this rate, the least developed countries would have to accelerate progress 100 times to reach the SDG target by 2030. Because of this poor sanitation status, children, and particularly girls, are being denied their right to education. But despite the slow progress, we are fully aware of the profound benefits that improving sanitation in schools would have. We know that a lack of safe and private sanitation in schools leads to high absenteeism and subsequent poor educational performance. We know that improving sanitation and hygiene practices in schools will reduce contact with pathogens and cut down the prevalence of diarrheal disease, typhoid, cholera, and soil-transmitted helminths that keeps children out of schools. We know that sanitation services that provide a safe, dignified, and private place for girls to manage their menstrual hygiene keeps them in school. In Kenya, we're pleased to announce that we're expanding the Make a Splash program to ensure that poor sanitation does not prevent children from accessing education, with the ultimate aim of inspiring positive, long-lasting sanitation and hygiene behavior change among students. The Make a Splash is now moving beyond simply providing sanitation infrastructure to targeting interventions that will strengthen systems to ensure that sanitation and hygiene services are resilient, maintained, and valued. The Make a Splash partnership is incorporating SATO's STEP program with UNICEF's existing emphasis on supporting sustainable improvements and management of school wash infrastructure and the practice of key hygiene behaviors. And through this work, we are partnering with SATO to innovate products and services that best meet the needs and preferences of students, teachers, and administrators across a variety of contexts. We're working with leaders from the local to the national level to ensure that sanitation in schools is prioritized and resourced and has the governance structures and regulations needed for sustainable, resilient, gender inclusive, and accessible sanitation services. UNICEF is also advocating with leaders to ensure that budgets are costed and financed for the capital infrastructure needs, as well as for the operations and maintenance to enable upkeep and proper usage. We're working with existing school and community structures to build capacity to manage these services and to deliver behavior change interventions. And we are generating evidence, working with the Kenyan Ministry of Education to strengthen the national online monitoring systems for Washington schools. This helps to demonstrate that these actions will result in sustained school sanitation improvements for all children. We believe that strengthening these systems, coupled with students who practice good hygiene behaviors, will result in long-lasting health, education, and environmental impacts. On that note, I wanted to welcome you all to the call and look forward to the discussion that we'll be having with my colleagues that are here from the Kenya UNICEF program, and to hear your questions and thoughts, how we accelerate progress on Washington schools going forward together. Thanks very much, Fred, and back to you.
Hello. Sorry,
back over to you, Fred. Yes.
Did you finish?
Yes, I have.
Okay.
Sorry. Yeah, back to you.
Thank you so much. I missed the last few seconds of your presentation, but thank you so much, Anne, for supporting us and the whole of the UNICEF team. We hope to reach even more children through Make a Splash. And I want to welcome next Christine. Without wasting much time, I want to hand it over to you to present to us what you are doing with the school sanitation. And I know you have some very insightful presentation to give us. Thank you so much. Over to you.
Thank you, Fred. And thank you, SATO, for having me. And of course, for everyone joining online. Let me just share my screen and hope that it's doing well. Okay, I'm getting a notification that everyone is able to screen and title slide. I'm going to assume this is the case, unless others are okay, so again, thank you everyone for joining online. My name is Christine Poo. I am a senior PhD candidate at Stanford University in the Civil and Environmental Engineering Department. I am here to share the key findings from a systematic review that my team and I recently conducted. And perhaps more importantly, I'm here to discuss some of the implications of that work for how we can facilitate a more sustainable approach to delivering sustainable water and sanitation services in schools. A quick note before we begin, this paper that we're about to talk about has been published and it is free for everyone. So if you Google this title that you see here, the +1 link should lead you right to it. All right, so diving in, access to safe and reliable water, sanitation, and hygiene services remains low in low and middle income countries. Globally, 1 in 3 people lack access to safe drinking water. More than half of the population lacks access to safely managed sanitation services, and over 3 billion people lack access to basic hand washing facilities. What you're looking at here is a map illustrating the modeled proportion of the population without access to a hand washing station with soap and water. And countries that you see shaded in orange, yellow, and red, more than half of the population lacks access to this basic service. When we talk about improving WASH access, we often talk about new infrastructure investments. And schools are often recipients of these infrastructure investments because they are a critical institutional setting. Students spend a significant portion of their time in the classroom. They're more vulnerable to infections than adults, and they can spread pathogens to other family members as well. Delivering programs through schools can also be a cost-effective alternative to targeting individual households, especially in sparsely populated areas. Now, improving WASH access is going to require the construction of new infrastructure, But construction does not guarantee reliable service. If we want to ensure reliable service, the physical infrastructure must be well maintained, and the consumables required to properly use the infrastructure, such as soap and water, must also be consistently provided. However, evidence suggests that it is really challenging to do that. It's really challenging to sustainably deliver wash services in schools. And a variety of studies estimate that at any given point, 33% or more of wash infrastructure is non-functional. And so well-intentioned and well-funded projects often start off like the picture you see on this slide, but quickly end up in a non-functional state on the right. The challenges associated with delivering sustainable wash services have been well established, but there's much less evidence around how to successfully tackle them. Prior research has concluded that the key reasons for unsustainable wash service delivery include limited budgets and resources, irregular monitoring and oversight, unreliable water sources, and ineffective accountability systems. But recent interventions that have targeted these barriers, or at least tried to, alone or in combination, have had mixed results at best. Given these mixed results, our team wanted to better understand the necessary and sufficient conditions for sustainable wash service delivery in schools. We drew on literature published over the last 20 years to, one, synthesize the evidence around the enablers of and the barriers to sustainable service delivery. Two, to examine how effective previously implemented interventions have actually been at improving sustainability. And three, to identify the critical knowledge gaps and the intervention priorities that remain in this space. What you're looking at here is a flow chart demonstrating how we filtered for the relevant studies in our systematic review. But in the interest of time, I'm going to let and invite audience members to visit our paper online in case you have more questions about our specific methods. After screening over 3,800 articles, we arrived at a set of 19 final studies. 10 of these studies were experimental studies that tested a specific intervention. 9 of these final studies were observational studies that had a shared goal and broad objective of trying to distill and identify the enablers of and barriers to sustainable service delivery. Today, I'm going to share 4 main findings from our analysis with you. The first key finding is that the majority of interventions had negligible impacts on sustainability. Interventions in our systematic review ranged from providing financial support in the form of cash transfers and free supplies, to constructing new infrastructure and providing free rehabilitation services, to providing free trainings, checklists, and worksheets to build capacity. When you look at the interventions focused on improving the regular provision of consumables, you see that they did increase the availability of soap. But they had a limited impact on the availability of water for hand washing and on water for drinking. Discouragingly, interventions focused on improving the maintenance of infrastructure had limited impact on the accessibility, the cleanliness, and the structural integrity of latrines and water source points. Collectively, when we look at the literature included in our systematic review, we see that most efforts to improve the sustainability of wash service delivery in schools have failed. And this conclusion holds true when you're looking at interventions that only delivered financial resources or interventions that had multi-component intervention arms that included cash transfers, new infrastructure, monitoring sheets, as well as trainings for teachers. Our second key finding was that observational studies emphasized different system needs than experimental ones. In our experimental studies, interventions always included at least one of the following components: providing physical infrastructure, such as hand washing facilities, providing consumables, such as soap or cleaning supplies, or providing financial resources to cover recurrent maintenance costs. These intervention components differ from the key barriers that were identified in observational work. In observational studies, authors consistently attributed the lack of sustainability to unclear information about maintenance responsibilities. They mentioned the lack of enforcement of existing maintenance policies, and they emphasized the lack of authority that teachers had when it came to making maintenance-related decisions. If we take a step back and we abstract one level higher, we see that most of the interventions developed and tested experimentally focused on increasing financial and material resources available for schools for WASH service delivery. By contrast, all of the observational studies identified weak information and accountability mechanisms as the drivers of school service delivery failures. So why does this difference or divide in focus exist? One explanation is that one and many of the observational studies that we looked at were actually ex post evaluations of resource enhancing interventions that yielded disappointing results. So imagine someone implemented an intervention that focused on resources only. WASH service delivery did not improve as anticipated. A team of researchers were brought in to understand why, and their investigations revealed the importance of information and accountability mechanisms, areas that were not originally intervened on. Informed by these findings, we hypothesize that there are three simultaneously necessary components of a sustainable WASH service delivery system: adequate resources, timely and credible information, and functioning accountability systems. When we talk about resources, we are referring to the human, the financial, the physical, or even the natural assets here to support the system. We think that a functioning information sharing mechanism is one that delivers timely, credible information that individuals need for effective decision making. For example, this could include information about the status of the WASH infrastructure, but it could also include information about one's roles, responsibilities, and consequences for failing to meet expectations. When we talk about a functioning accountability mechanism, we're referring to a set of measures that confront individuals with meaningful incentives and consequences for their choices and behaviors. When we then look at this framework in the context of the studies we reviewed in the systematic review, we see that no study intervened on all three components simultaneously. Interventions that targeted accountability mechanisms were particularly rare. And, that's perhaps not that surprising because designing an effective accountability mechanism is really demanding, and it requires skills, disciplinary perspectives, and local expertise on sociocultural norms and institutional norms that haven't been featured prominently in WASH fields to date. At the same time, however, the results suggest that continuing to move forward with resource-only interventions is unlikely to yield meaningful gains in sustainable service delivery, unless and until interventions also address information needs and accountability mechanisms, including the formal and informal incentive structures that shape individual behaviors. These interventions will likely fall short of achieving sustainable impact. So now the question is, where do we go from here? For one, we need to be thinking a lot more about information flows. Where are the existing information bottlenecks that are preventing sustainable service delivery? What types of information might be useful to collect? To whom or what entity would it be important to deliver this information to? Once we have a better idea of these system needs, we can then think about what are cost-effective strategies to deliver such timely and credible information. There's currently a lot of excitement around sensor-based technologies and remote sensing technologies that can provide real-time monitoring and updates about the status of WASH infrastructure. These technologies do hold a lot of promise here. But what we want to emphasize is that an effective and functioning information system does not need to be high-tech. They just need to get the right information to the right people at the right time. Once you collect and deliver the information, you're also going to need functioning and effective accountability mechanisms to make sure that the information generated will actually be acted upon. The individuals that receive this information must also be incentivized to use it. There's actually a wealth of ideas and evidence in this space specifically about accountability mechanism design in the social psychology, public management, and political science fields. And a lot of that insight could be really useful when we're thinking about how to design accountability mechanisms for service delivery. Within those circles, the effectiveness of accountability mechanism depends on 4 key attributes: the timing, whether an individual is held responsible before or after the decision is made; the source, so the party or parties to whom one feels accountable; the salience, so the extent to which individuals feel like they're being held accountable for outcomes that matter for the overarching goal; and the standard, so whether individuals are being held accountable for processes or for outcomes. These considerations are a good reminder that we should really rethink the institutional arrangements that we are currently assigning responsibility for when it comes to WASH service delivery in schools. Current approaches to service delivery often rely on uncompensated volunteers, both as individual champions or members of school and health committees. These individuals, the very ones that we've assigned responsibility to, often lack the incentives, the authority, the political support, and the resources to hold important stakeholders accountable. And so we've thus set up a system where those expected to demand accountability from service providers often have the least agency to do so. There's a lot of white and blank space in this field, and it's really ripe for contribution. So one clear next step that we see is really thinking about what alternative service provider mechanisms or setups or arrangements could look like and the conditions under which they would be effective. One thing we really try to do when designing this framework is to make it simple. And we really tried hard to think about the important causal conditions identified in the studies in our review, what they represented, and we really tried to distill them into 3 system components that we hypothesize are simultaneously necessary. We are advocating for a systematic process of identifying system needs using these lenses and using this framework, but we're not advocating for generic solutions. In this framework, we're trying to promote the idea of best fit approaches over best practices, because what the resource, information, and accountability needs look like will differ by context, and local expertise will be essential for operationalizing these concepts. In this systematic review, we did focus on WASH service delivery in schools, but the tendency to pursue resource-only interventions to enhance service delivery also has been documented in other contexts and sectors. And so similar challenges have impacted and do impact the delivery of irrigation systems in smallholder farming communities, or even health services. And that makes us think that this resources information accountability idea or framework or set of components could be relevant and extend usefully to other service delivery types, as well as other community and institutional settings like healthcare facilities. With that, I would like to thank my co-authors on this paper and the funders that made this work possible. We've actually taken a lot of these learnings from this review to inform the design of an operation and maintenance intervention that we're scaling up and testing across 200 schools in a randomized controlled trial in India, along with World Vision. So if you're interested in that work, want to discuss more, or have any questions about what I've presented today, my email is here, and I would love to get in touch. Thank you all, and back to you, Fred.
Wow, what an amazing presentation, Christine. Thank you so much. And we want to thank the whole of Stanford University for supporting this kind of research. One thing about public health issues is that we must invest in a lot of research to gain the knowledge that we need to design effective, sustainable programs, especially when it involves school sanitation as well. So we thank you so much for also finding time to present that. And please pass our regards to all your fellow researchers and co-authors. And we will be looking out for that publication as well. So thank you so much for that.
Thank you.
I mentioned during the beginning of this live session that we are going to co-host this together with UNICEF, and we have what you're calling the school's viewpoint. That this is a panel that is moderated by Hodaka. Hodaka will work very closely with him here in Kenya to support sanitation and hygiene in peri-urban areas and also for schools and communities in rural areas. And very recently, when the management team was here, we joined UNICEF in visiting some of those schools in Kitui County. And we are so happy to have one of the representatives from Kitui County joining Hodaka as well. So I will hand over to my co-host for the day, Hodaka, to share that panel discussion. As we take in more of your questions, please keep them coming. We will have a Q&A towards the end of the discussions here. And we are taking note of the questions on the chat. So please continue asking the questions and making the comments, and we'll get back to you today. Thank you. Over to you, Hodaka.
Yeah, thank you. Thank you very much, Fred. Yes, so for a great introduction. My name is Hodaka, working for UNICEF Kenya. I'm with Agnes McKinney, OIC Chief of WASH, UNICEF Kenya, and also Justina Pereira, Kitui County Ministry of Education. We're going to talk about WASH in school viewpoint, specifically for Kenya. So first, let me ask Agnes about the general situation about WASH in schools. So Agnes, could you tell us about the situation related to water, sanitation, and hygiene service in Kenyan school? So over to you, Agnes.
Thank you very much, Hodaka. And it's evening here, and wherever you are, it's a good day to you. So I'm Agnes Makanyi, Water, Sanitation and Hygiene Specialist with UNICEF, and currently the OIC for Chief of WASH in UNICEF Kenya. So the situation in Kenya, the studies we have is that 72% of the schools have access to basic drinking water services. But of course, we have a challenge with this data because it has not been giving us mainly the functionality status, whether it's reliable or not, but it's just whether they have a water point or not. And sanitation is quite poor, with only 50% of the schools having access to improved sanitation facilities, and the hygiene was at 2% with the rural schools which have access to hygiene services. And in terms of latrine ratios, for the boys, they have a latrine ratio of 1 toilet to 34 boys and 29 girls to 1 door, which of course is not meeting the national standards that it should be 1 toilet for 30 boys with a urinal and 1 for 25 girls. So it's still a big challenge. And without having these gender responsive sanitation facilities and hygiene, it becomes very difficult, especially for girls, to be able to go to school because of lack of the mess to hygiene management facilities and the lack of privacy in the schools. And moreover, lacking also even the products for mess to hygiene management makes these girls even not to attend school and to miss school, which is a key challenge for them. And a study which was done for around 1,000 Kenyan girls shows that 54% face challenges with access to menstrual hygiene management products, and 22% were using improvised materials. This was a study done by Ministry of Health in 2019, and on average, they miss 4 to 5 days of school per month. So this really makes them not to have equal opportunities with their counterparts, the boys, and this eventually affects their performance and also retention in schools. Thank you very much. Over to you, Andaka.
Yeah, thank you very much, Agnes. So I want to invite Madam Justina from Kitui County Ministry of Education. So UNICEF and RICS have been working in Kitui County since 2018 for Make a Splash partnership, global partnership between UNICEF and RICS to improve sanitation situations. So this time I would like to ask Madam Justina about the situation in school in Kitui County. So Madam Justina, over to you.
Odaka, sorry, Justina is having connection issues a little bit, and we're trying to sort her out. But maybe as we wait for her to come back online, maybe you can just give us a brief of what we've been doing in Kitui County and how the government of Kitui has been really supportive of us, including maybe some highlights from the visit, and then we wait for her as she comes back. Thanks.
Yeah, well noted. Thank you, Fred. So I think Agnes, you can tell us about the situation in Kitui. She visited so many times the county for observing the situation. So could you tell us about the Kitui situation, Agnes?
Yeah, thank you very much, Odaka. Yes. Activities in Kitui, and so I'm familiar with the Kitui County, and the situation is not very bad from the national situation. It's almost the same. So a survey which was done in 2017 showed that only 20% of the schools had maintained the facilities, and around 25% had not maintained the existing sanitation facilities. And actually, in terms of separate latrines for boys and girls, 85% have separate latrines for boys and girls, which is good. But we saw that over half of the schools were just partially maintained. So the main issue in the Kitui schools is mainly the functionality of them. So you find most of them not having the privacy. You find them not having a good floor to clean, or they are filled up. So the toilets are in, but the main challenge is meeting the standard latrine ratio, and also the privacy and the functionality of the toilet. So in terms of addressing the issues, then it would mean that we have to work closely with the boards of management to address these issues of sustainability of the wash facilities. Thank you, Ondaka.
Yes, thank you, Agnes. Fred, I'm not sure if Justina is back.
Just to mention as well for our participants online that so in Kitui is when we installed the first SATO pan, and there's a lot of feedback that has come through this kind of customer talks and through engagement of many of our partners in Kitui as well. And those engagements and the questions also coming in also inform the innovations and programs design that we work in as WASH stakeholders to improve sanitation in Kitui County. And it is unfortunate we still don't have Justina online, but we can also say that for maintenance, there's been a lot of discussion on maintenance, especially also during World Toilet Day, when we're discussing how do we maintain the latrines that have been upgraded or improved to an improved latrine status. And we are always saying for us to have sustainability, there has to be a strategy, and it's very nice that in the chats as well, there are people giving in their ideas, and we'll have some Q&A and some responses at the end. So thank you so much for everyone sending in their comments and sending in their questions. I'm going to move to the next presenter so that Dr. Hodaka can also try and reach out to Justina. And then hopefully if we get some time, we can allow her to maybe share something that she wanted to share with the whole of the participants. So thank you so much, Dr. Hodaka. We are very, very proud to have you here. You're doing a very great job in supporting all those WASH activities in the region here. Thank you so much.
Can we just say briefly what we are doing about the specific partnership?
Yeah.
Okay, please. Okay.
So maybe, Agnes, I can ask some questions. So yeah, as Fred mentioned that we have a co-valued partnership with Lixil since 2018 in Kitui. So could you tell us about the impact that our partnership made in Kitui and also in Kenya itself?
Thank you very much, Ondaka. Yeah, so we have UNICEF has partnered with Lixil in Kitui since 2018 in this project on Make a Splash. And this has really had an impact on the school children through demand creation, and specifically in the sanitation marketing, which involves also the communities. we have over 300,000 people who have gained access to safe sanitation facilities over the last 3 years. And LICSIL and UNICEF has also developed the capacity of over 2,000 sanitation actors. That includes public health officers, artisans, community health volunteers, and youth in the construction and improvement of sanitation facilities. Specifically in the schools, we have worked with the LICSIL to improve the sanitation environment in 129 schools, which has really transformed the lives of around 58,000 children in the schools. And this has really been through enhancing the environment and making it to be more clean, and to make sure that we can address the issue of cleaning them, keeping off the smell, and also the key messages on appropriate hygiene practices in the schools. Thank you.
Thank you, Agnes. And also, Agnes, could you tell us more about the Wash in Schools program, especially school toilet enhancement program, which we just started implementation in Kitui County?
Thank you very much. Yeah, so as I have mentioned, poor operation and maintenance is the key challenge of the sanitation facilities in the schools. So to enhance the functionality and cleanness of these sanitation facilities, we partnered in these 129 schools with the LICSIL, and we were able to install that 1397 SATO products in these schools. And this has really enhanced the hygiene of these schools. And so we are partnering together now on the STEP program, or the School Toilet Enhancement Program in Kitui. And this will target 110 schools in Kenya by 2024. And we are now, we have selected the first 10 schools to implement. And for these SATO products, which we implemented in the schools, this has really helped to clean the toilets, removed the bad smell, and also made it very airtight so that it prevents flies, which can spread diseases. And since the School Health Club is mainly tasked with connecting the children on how to clean the toilets, they have a roster where each class has a day for cleaning the toilets, and they have to bring some water for mom if they don't have water in the school. So this has made it very easy for the School Health Club, and to make it also very nice and prestigious that they have these SATO products. And so even the stools have really been used very well for the children with disability, because we have done one tour in each latrine block for boys and girls to ensure that children living with disability are able to access these toilets. So we have received information from Kitui that children who are away from school because of disability now are coming to school, because they can have their meals and use a toilet which is friendly to them, from the SATO stool, and also from the handrails, a ramp, if they have a wheelchair, to be able to use it well. So I would say that we have received positive reports in terms of this SATO stool, and also the pan, the squat pan, which has really been helping these children to clean their toilets well, and they really feel like well associated with this product, which is also being used in the communities. And we look forward to really piloting this in many more schools and creating demand such that the schools can be able to purchase them and continue to enhance their toilets. Thank you. Over to you, Ndaka.
Yeah, thank you, Agnes. So I'm not sure if Justina is back now.
I think she's back now. Maybe can you hear us, Justina? Maybe you can just give us a hello if you can hear us. Then okay, she's not joined. So I think mostly Agnes has really covered a lot of the issues, and maybe back to you, Hodaka, if you still want to engage.
Yeah, maybe then I have two more questions, Agnes. The first question about the sustainability of wash facilities. How does UNICEF or county government ensure the sustainability of wash facilities constructed in schools? So what do you, Agnes?
Yeah, thank you very much. What UNICEF has been focusing on is to engage the government from the national level to county level, and has been focusing on advocacy to ensure there is a budget allocation for WASH in schools. So we have now currently a pre-primary education fund where we have some components allocated for sustainability of these facilities. There's a sanitation budget, and there's one for repairs and maintenance, and there's another one for water and conservancy. So these budgets are helping to sustain these facilities because at least the schools have an allocation in relation to WASH facilities. And then at the county level, we have been asking also the county governments to match or to leverage the funds we give them. For example, when we implemented in Kitui in 30 schools, the county government also did the same in 30 schools. So this helps them to make sure that they are allocating a budget as part of the county integrated development plan to make sure that there's sustainability of the facilities. And then we have been supporting also in relevant policies. There is a school health policy which details closely what should be done about WASH in schools and who is responsible for the maintenance of these facilities. So this has really enhanced that. And also we have worked on standards and guidelines for WASH infrastructure in schools, which has helped all the stakeholders and the BOMs to know what to do in terms of maintaining the facilities. And the private sector has not been left behind like what Lexil is doing. We are bringing them on board also to construct the toilets in schools and also as part of corporate social responsibility to be able to support more schools to improve their latrine ratio and the cleanness of their toilets. And then lastly, we have a challenge with data to show what is the situation in the schools, and we are partnering with Ministry of Education to ensure that we include WASH in schools indicators in the NEMIS platform. Already we have done a workshop where we developed the GMP aligned WASH in schools indicators, and then we trained all the county quality assurance officers on WASH and these indicators, and currently we are just waiting for the Ministry of Education to approve a memo to go to all the 8 teachers so that we can train them again on the indicators, and then they can upload this data in NEMIS. And this will really be a strong advocacy data for us to be able to really say, these are the schools you need to support, because Ministry of Education has an infrastructure department, which has a budget on infrastructure. And there's also a school sanitation program, which is just supporting schools in the country. So this will really help us to align and then have the needy schools be supported in terms of sanitation facilities. Thank you, Ondaka.
Thank you, Agnes. So this is my last question. Do you have any personal stories or experience that you want to share with participants who are joining today?
Thank you, Ondaka. So the story I want to share is that when I received data from Ministry of Education on the situation in the schools, it was looking very well that over 80% of the schools have access to sanitation facilities. But when I visited the schools, I found that the toilets were not functioning. And then when I asked the 8 teachers, why are you not reporting well? They said, we fear that the schools will be closed because public health will say we do not have adequate toilets for the schools. And then we partnered with Oxford University and Fundfix in Kitui, and the survey was done, which was now showing the real situation in the schools. And using this survey, we worked with Ondaka here and selected schools for these 129 schools which are supported by government of Japan. And when we went on ground, we found this, the situation was bad, and some schools were not having toilets. In fact, one of the schools I went to and requested to use the toilet, I was referred to the marketplace. And that toilet was being shared by the teachers, the market people, the pupils, and it was really pathetic. So we passed on the message to Kitui 8 teachers that please, when you are filling the information, fill the right information. Now your school has been left out because you indicated a very good situation. So that's the story I would share, that really the parents put in effort to put the toilets, but they need to be disseminated and guided on the standards. And they also need to be sensitized on the operation and maintenance, and also other partners need to know when they're inputting the capital cost, they should do the life cycle costing, where they look at the initial cost and also the maintenance and operation for the lifespan of these sanitation facilities. Thank you. Over to you, Doug.
Thank you very much.
Sorry, Daka, you're on mute, eh?
Hello?
Yes, we can hear you now.
Okay, good. Thank you very much, Agnes. And then sorry for the technical issues we faced. So Agnes, Justina, I will stay online and we're happy to receive any questions or comment. So thank you very much for your attention, and over to you, Fred.
So much for Daka and Agnes. It's unfortunate we couldn't have Justina, but please pass our regards. And we really appreciate also her trying to join even after she's experienced those technical challenges. Because of time, I'll move straight to Alex. Alex, like I mentioned, is from the Toilet Board Coalition. And I think I'll hand over the mic immediately to you so that we have enough time to address at least 1 or 2 questions at the end. Thank you so much.
Thanks, Fred. Next slide. So, hi everyone, I'm Alex Knezovich, Managing Director at the Toilet Board Coalition. And we were created with one very simple purpose: to accelerate business solutions to the sanitation crisis. Next slide. Over the last 7 years, we've built a membership network of over 80 members that comprises private and institutional investors, NGOs and academia, entrepreneurs, local service providers, and multinationals. Next slide. And over the last 18 months, and why I'm here with you today, our leading 3 corporate members have championed a piece of work looking at how we can attract more private sector engagement into school sanitation. And I'd like to first just precise that it's not just corporate engagement that we're looking at, or sort of the big corporate donors in CSR projects, but also those local service providers. So how can we attract more SMEs that are servicing public or community toilets or other institutions into the school setting as well? And so as a part of this work, what we've done is canvassed over 40 organizations that are active in school sanitation around the world to understand and highlight why businesses should engage and invest and what they can expect in return. The research approach has involved collecting and analyzing new qualitative data from structured interviews and focus group discussions across different key stakeholder groups. So most certainly the government, who we believe should remain in the lead on school sanitation, NGOs who have a wealth of expertise and knowledge and on the ground experience, development agencies, academics, and of course, businesses. Likewise, we've looked at secondary data such as extensively at existing literature, studies, reports, statistics, and documents that the team reviewed and analyzed. Next slide. And I won't spend time going into the problem because we've talked a lot about many of the problems. But one thing that we did see, and this is a piece that came out from the Domestos team, which is a brand within Unilever last year, was looking at globally across developed markets and developing markets. 1 in 5 children globally are saying that their toilets are not up to par, and they're also not talking about it with their families. So I think much like the previous speaker was saying, that the teachers were not communicating about it. In general, I think there's a real challenge to communicate on the sanitation situation when you're not happy with it. But 1 in 5 children are experiencing physical discomfort or an inability to concentrate because they're holding it in, because the facilities are unusable. Next slide. And so in our interviews with the businesses, what we heard is that all have observed a positive impact on their business, whether that be improved brand equity, positive publicity, increased sales, additional partnerships, increased employee engagement, or job applicant interest. Now, we're not suggesting that businesses purely focus on profiting or understanding how they could profit from school sanitation. Investing in school sanitation is because there's a real need, and because there are skills and resources that private sector as a stakeholder group can really bring to this situation. It's the right thing for business to take care of the societies that they operate in. And we also know that it makes business sense, because when it makes business sense, also that investment will be more sustainable and will have a greater longevity. And so we've been looking at these 5 sort of themes in our discussions and interviews and our research, and I'll share a little bit about it with you today, and then give you a bit more. And we have a publication that will come out on January 24th that will go into detail. So the brand equity and power. ESG, environmental social governance reporting, is having an increasingly important impact on consumer brand preference. There's a 7-to-1 benefit cost ratio in providing water and basic sanitation in developing countries. So this is likely even greater in schools because of that spillover effect and the role that they play in the community. So the work on the ground in communities is giving brands something very valuable to share about. Secondly, long-term market penetration. So investing in the development of healthy, hygienic behaviors at a young age results in improved behaviors in the long run. And for businesses, this is then opening up new markets and moving consumers up the pyramid for them. Partnership potential. The brand benefits are not only, of course, for corporations, but also small and medium enterprises. So the business opportunities and social impact for these SMEs comes hand in hand in schools. They're a great starting point for partnerships, whether it be for corporates or SMEs. Recruitment and retention. So purpose-driven programming enables employees to use their skills for social good and attract and retain top talent. This isn't only for incredible visionary brands like Lixil and SATO, but also for corporations that maybe don't have quite like the literal line to water and sanitation. This kind of programming where they can bring the skills of the private sector directly into impacting social issues are incredibly valuable in today's market. And then new market potential. So school children are the customers of tomorrow, but schools themselves are the customers today. And there's a market for the educational system, particularly for local enterprises in service provision. Next slide. And so a piece of what we've done is really look at how can we quantify that market potential? So as we look at schools, we have methodology that we use at the Toilet Board Coalition to look at the potential value of the products and services in what we call the sanitation economy. And so what we've looked at in this report is the school sanitation economy. And what does that look like in the wider ecosystem of sanitation service and product provision around the world? And so we took 3 geographies, the Philippines, Mexico, and Nigeria, and looked at the school sanitation economy in those environments. And you see the numbers on the screen. But for the Philippines and Mexico, it's looking like an annual market of about 1 billion. And then in Nigeria, about 622 million. So this encompasses the products and the services, the renewable resource flows, data and information that can transform sanitation systems in cities, communities, and of course businesses. This includes the access to toilets, what we call the toilet economy, which is the detailed product listing that you see on the right side of the screen. And then next slide. Also the applying a circular economy approach to sanitation. So looking at how can we capture and build on the value of the resources in the sanitation system. Next slide. So at the Toilet Board Coalition, we are focused on accelerating action and business solutions. And so this is how we've come at the school sanitation situation and seen how can we as business leaders contribute to this challenge, and how can we attract other corporate and SME engagement into the school sanitation space by showing them quite plainly what is on the table for them and why it makes sense for them as a business to invest in this beyond maybe just a CSR kind of perspective or a philanthropic perspective. I didn't want to spoil the whole publication, of course, because that wouldn't be very wise of me. So in it, we will outline the 7 reasons we say to invest in school sanitation for businesses. encourage you to please, Lixil has taken a big part in championing this work alongside Unilever and Kimberly Clark. So I'm sure it will be shared on their channels as well, but please do follow the Toilet Board Coalition on LinkedIn, and you'll see the release of the publication on the 24th of January, International Day of Education. And with that, then, Fred, I hand it back to you.
Thank you so much, Alex. It is very, very good to read your reports. It is people do not know how much there's potential in the sanitation circular economy, and it's a good thing you mentioned it at the last of your slide. I could see Nigeria there with millions of dollars. And I think one of the things that people always forget is that when you call on the private sector, they always think about the big organizations, but there are so many private sector partners that we're working with to improve sanitation, especially for schools. We have the Masons, we have sanitation entrepreneurs that need support as well. And I know Toilet Board is also doing a lot to support those kind of private sector partners as well. So thank you so much for the nice presentation. You can check Toilet Board Coalition online and you see the nice reports that we have. I think we are going to move to our Q&A session. There's so many comments and questions that have come through our chats. And I think the first one, I'm going to send it to Christina, because from Christina's presentation, we picked up 3 key words that we should take home: resources, information, and accountability. And one of the participants asked, how does monitoring, frequency, and mechanisms fit into this accountability framework? I think that was a very good question from one of our users online, and I hand it over back to you. Maybe you can have a comment on that.
Yeah, thank you, Fred, and thank you for whoever asked this question. So for me, I think the information and the accountability mechanisms are both tied in this idea of monitoring, right? So monitoring is great because you're generating all this information, but that information is only good if someone's going to use it, and if someone is going to use it to make an important decision. So when you're setting up monitoring frequencies or thinking about the systems that you should be using, the things that I would reflect on, or the things that our team advocates reflecting on, are who's collecting the information, and is that person incentivized to do so? What information is being collected, and how much of that information is actually going to be used, and for what? Who is that information being delivered to, right? Who's on the receiving end of that? How is it going to get there? And for the person receiving, what incentives do they have to actually act on the information? And a part of the incentive piece is also capabilities, right? So what are the systems set up so that the person receiving the information can actually use it and actually have the authority to make decisions or hold others accountable or make a change in the system? What we're seeing often is when you're setting up these systems and, having teachers step in or having students step in, these aren't always individuals who can manage the budgets or have the authority to make as many maintenance related decisions as maybe we assume or would like them to have. So I take your point that frequency is an important part of thinking about that system, but there are also these other pieces that are more fundamental, even before we get to the how do we do it. And with respect to how, I think there's really, really wonderful literature coming out from the technology side and the remote sensing technologies. And I know there's a wealth of literature out there, both for latrines and sanitation, but also for drinking water, not only quantity, but quality. So happy to chat more about that if you shoot me an email and I can send some references over. But certainly an exciting part of research going forward.
Thank you so much for that, Christine. And we encourage the participants to connect with the presenters online, and you can have some follow-up questions because our time for this is limited. So I wanted to ask the next question to one of our panelists, Erin, who is the CEO, our global leader for SATO. It's a rather long question, but it's a very good question, I think, from one of the participants. He asked, what is the nature of SATO's projects? Is it on CSR basis? Or is there a business component to it? And if yes, how does it work out with schools? Or if it's mainly through courtesy of partnerships, is it entirely non-profit, say through groups like UNICEF?
Great. No, it's a great question. And I think ties very much to the presentation that Alex gave and some of the examples that were highlighted by Hodaka and Agnes. We as SATO believe that market-based sanitation is the most sustainable approach to scaling access to sanitation. And so we then work with local businesses to increase access through local entrepreneurs or retail points, and that schools become an important customer of that. Of course, as we've already heard, funding challenges or even awareness of solutions can be that first barrier that communities are facing to upgrading facilities and providing this access. And so we do a combination of some projects in partnership with UNICEF, in partnership with other corporate partners, which we would love to continue to do, in order to do our STEP program where we're upgrading these facilities, demonstrating what can be done, and then working very, very closely with the government, such as the Ministry of Education and Health in Cotuí County is one example, in order to then replicate that, to scale it, and to ensure and monitor, as Agnes highlighted, that these facilities are being maintained and used. So market-based solutions, market-based approaches, we believe are the sustainable approach to be taken. And we are working very closely with the government programs and the systems to ensure that we can replicate and scale those and maintain them on a sustainable basis.
Thank you so much. And I hope that you've addressed that question to one of our participants. I'm not seeing a follow-up question here, but thank you so much, Erin, for that. There's a question because we wanted to have as many questions as possible, but we have 15 minutes to go. So there's a question here for Alex. And the question is based on the presentation from Toilet Board Coalition. It says $912 million and $1.2 billion for Philippines and Mexico, respectively, is the sanitation market size is impressive. Are the schools in those countries funded to those amounts annually, or what does the government do that sets them apart? I think that's the question. Yeah, thank you.
Yeah, certainly. So those part of how we come to those numbers is yes, looking at the policies and the budgets to ground the numbers as much as possible in reality and in what is currently being provided. But also there is an aspect of this because, for instance, all of those schools don't have toilets at this point. So it is not a depiction of the current situation. It is rather a market estimation, a projection of what is possible. If we did have all of the schools online in a sanitation sense, and they were thriving in terms of the products and services that were really being activated, then that would be the market potential. So to be clear, those numbers aren't a reflection of the current budget in those countries for school sanitation or the current capacity, let's say, in the schools for product and service provision. What we're looking at is from an ecosystem level, how do we activate these markets? How do we bring in innovative financing mechanisms like outcome funding, for example, into the school sanitation space to activate those opportunities? And how can we work with public and private investors and businesses to help create the ecosystem around school sanitation where it is a financially viable and sustainable opportunity in the long run? I hope I've answered that. And if not, please do reach out to me. And I know I'm saying numbers and we haven't put the report out, which is really bad practice, but it is finalized and the numbers are final. So we'll have those out soon with more background to them. Yeah.
Thank you so much, Alex, for that. And I know there's a time, and somebody mentioned to me before you leave, maybe in 1 minute, Alex, maybe you can just come back for just 1 minute. Somebody's asking, maybe you can tell just a little bit more on circular economy on sanitation and how it is implemented. I think that's one question, and then maybe we go to next.
Sure. Yes, very quickly. So we see primarily what the Toilet Board Coalition does is we run an accelerator program for SMEs in developing markets that run sanitation businesses, and we pair them with corporate mentors and do that skills transfer I was talking about earlier. There's so much innovation out there in the sanitation space, looking at the valuable resources and information that is flowing through our sanitation systems on a daily basis. So you may have noticed, for instance, during COVID, there was a lot of wastewater-based monitoring for infectious disease. That's an example of the information that's flowing through a sanitation system that could help inform public health measures. But also from a resource perspective, there's a lot of things that you can do with human waste. A very quick story is of secondhand tomatoes. And this, I can't take credit for this story, but there's the tomatoes that fall off the vine in the field. There's the tomatoes that as you're making your dinner, you put into the compost, the scraps. And then there's the tomatoes that you put into your toilet at the end of the day. And all of these have nutrient value, and we want to be returning them to the soil. Human waste is one of the only resources that actually grows with the population. So whether we're using it for electricity or for nutrients or for other things we haven't even dreamt up yet, it's a really interesting place for us to be looking for resources and to contribute to more circular and regenerative systems as a global population.
Thank you so much, and I'm going to let you go now. But I encourage everyone in the call to please just read the reports being shared by Toilet Board Coalition. They give great insights into the sanitation circular economy, and you can get a lot of information to drive your sanitation initiatives, especially for schools. Just one last question goes to Hodaka, and from the panel discussion. In Kitui, you mentioned that the government is investing money to support schools, and somebody was asking if the schools know that these funds are available for improvement of sanitation, and whether it's only in Kitui or it's also the whole of Kenya. That's the question. Thanks.
Yeah, thank you, Alex. Fred. So I hand it over to Agnes.
Yeah, thank you for that question. Yeah, so the funding is available for all the schools in Kenya. Is through pre-primary education fund. The government subsidizes education in Kenya. So there's a budget line which goes to the general account for the schools, and those budgets are there. About the awareness for the boards of management, they are part of the board of management manages the activities in the school. So they may not on that, but the head teacher has knowledge and has been trained on. Then the board of management, they have to go through the budget and approve. So they have some information on that there's a budget for WASH. The only challenge we experience is that they reallocate the budget to other activities instead of using it specifically for the WASH facilities or maintenance. So that's the only challenge that they would say, this time we have an opportunity, or our classrooms are poorly done, so they take the budget for sanitation or water and use in that. But otherwise, it is part of the budget they receive from the government for all the schools, and they are the ones supposed to plan and approve how it is used. Thank you.
Thank you very much, Agnes. There's so much to learn from you, and hopefully our participants, when they visit Kitui, you can also show them what you've done physically and exactly what you saw in June this year. You guys are doing a very good job, and thank you so much for having that passion to change the lives of the people in Kitui. Thank you so much. Because of time, I'm going to thank all our panelists today. Very great presentations. It's a discussion that we wish you would have wanted a lot of time on, but unfortunately, we have limited time. So I'm going to call on Erin to give our last remarks. But before then, there's something that Hodaka mentioned, and also Agnes mentioned it. It's called SATO Step. It's one of the initiatives that we are working on to improve school sanitation as well. And I'm going to hand it over to Erin to also make a final remark, and then we'll have a short video to show you what we do with SATO Step, the School Toilet Enhancement Program. Thank you so much.
Great, and thank you, Fred, for being an amazing host, and I think helping us to get through what is a really meaty topic with several real experts. And thank you so much to all of our panelists, Christine, Agnes, Hodaka, Justina, even though we had some difficulties, and Alex as well. You know, for me, I always walk away from these customer talks having learned something new. And I think the idea that a third, 33% of facilities that we have invested in and built as partners and as a sector are not functional in basic reporting. And so how do we as a sector start to look at some of the challenges in that? And I think we heard some really great suggestions in terms of new frameworks from Christine, in terms of information and accountability, highlighted through multiple aspects, the challenges of realistic funding and getting the committed funding. And I think this idea too of really making sure that the solutions and what we're offering to the schools and creating as a tool for these schools to use is fit for purpose. It's a best fit solution, not a best practice solution. So really great ideas. And I think based on all the comments and really rich questions in the chat, I think opportunity for many of us to come together and partner to start to bring some of these solutions into schools. For me, I think the mandate for SATO to continue to invest and bring our portfolio of products into these schools and work with governments, work with our other partners, including UNICEF, USAID, and the other corporates as well, to be able to scale our school sanitation and have the impact that we want to have, and what these communities deserve is even more clear. So I want to thank everyone again for joining us. We'd like to leave you for now with a short video outlining our STEP program that we mentioned. And if you are a partner that is interested in upgrading your own facility from the Ministry of Education, from the Health, a school community leader, or if you're a corporate wanting to think about your CSR, ESG programs, we want to work with you. And so please do get in touch. We'll have contact information at the end. But thank you again for being part of these important customer talks. And let's take it to the video.
Thank you everyone for joining us today for this exciting discussion. And we want to also invite you, please follow us on LinkedIn, and we look forward to having you again in our next customer talks. Have a very good evening, morning, and a great day. Thank you so much, everyone. Bye.